Welcome to another episode of the Wednesday Checkup. Today's topic, COVID-19, because there's more confusion than ever before. And I think there are two main driving factors behind this: the media, and two, our leadership, more specifically, President Trump. I'll be addressing both of those points using several examples in this video. Let's get started.
You don't have a medical background, you're not a scientist, yet you're claiming this substance, which has not been studied in any meaningful way, can cure COVID, and you have a financial stake in the company. You would profit from it if this is being sold widely. Morally, is that right?
Well, I was contacted on Easter Sunday after, that I've told the whole country to pray for the answer for this pandemic. So this guy called me on Easter Sunday and said he had an answer to the virus.
This is all baloney. While I am very angry for him coming out and spewing this misinformation about oleander or oleandrin oil, which is poisonous, there's actually cardiac toxicity that comes from this. What I'm more upset about is CNN giving this person a platform. What was the purpose of bringing him on and making this into a national story when it wasn't? This actually led to President Trump being asked this question by a reporter.
Oleandrin? Have you heard of that as a possible therapy for coronavirus?
I've heard of it, yes. Go ahead.
Ask the FDA to
No, I
approve
haven't.
it?
I haven't.
Is it something you would support?
Is it something that people are talking about very strongly? We'll look at it.
He clearly has no idea what the reporter is asking. And the only reason the reporter is asking this question is because it was seen on CNN. I'm also really upset with CNN that they're wasting airtime on Mike Lindell, where we have great scientists that have hard-hitting stories that are really important to tell, including that the black population in the United States is being disproportionately affected by COVID-19, that there's certain difficulties in obtaining tests in low socioeconomic neighborhoods in the US. Why are we talking to the MyPillow guy? Let's move on to a tweet that President Trump himself retweeted, stating that only 9,000 people, incorrectly stated that only 9,000 people have died of COVID-19 thus far. The tweet actually ended up being removed for violating terms of service, but let's talk about where they got this number from. This 6% figure, or 9,000 deaths, actually came from a legitimate CDC document that said 94% of the deaths related to COVID-19 had several causes of death listed on the death certificate. And that's actually not that surprising. It is very rare for an individual to have a single thing listed on their death certificate, because for those of us who actually fill out death certificates, we know we put a primary cause of death as well as contributing causes of death. For example, if you have hypertension or your BMI falls in the obese category, you technically have risk factors and diagnoses that contributed to your demise, to your loss of life, but COVID-19 is what caused it. These are just extra things that made you high risk and more susceptible to COVID-19. That doesn't mean it wasn't COVID-19 that led to your death. It's very rare that a person dies specifically of a single illness. So, it is completely inaccurate to say that only 6% of people died as a result of COVID-19. 100% of those people died with COVID-19 and from COVID-19, and some of them had extra things listed on their death certificate, such as respiratory failure. Where do they get respiratory failure from? COVID-19. It's misinformation at its finest, and it causes you to think, oh, COVID-19 is not as deadly as it looks. COVID-19 takes our most fragile patients, and it leads to a high death rate. It also affects the younger generations and creates complications for them at a lower death rate, but still a serious illness that we must not write off. Let's look at this headline from kpbs.org. COVID-19 and the brain, quotes, "You should be afraid." Not only do I think this is an absolutely trash headline, it capitalizes on humans being afraid of COVID-19 in hopes that they would click on this article and read it and they would raise more money via advertising. I think this is the worst type of healthcare reporting because it's dishonest. While we are seeing some long-term effects related to COVID-19, we also see long-term effects of any person that's admitted into an ICU. If you're in an ICU for a heart attack, for diabetic ketoacidosis, for sepsis, coming out of that ICU will be a long recovery process. Your lungs will be scarred, you will have inflammation in your body. At certain times, you'll have neurological symptoms, brain fog. This is classic ICU protocol in coming out of the ICU. It is not the norm to see long-term health effects of COVID-19. Most people will get better with COVID-19. Most people will recover and not have any serious long-lasting symptoms. There will be a subset of the population that will have some lingering symptoms, just like they do with a serious case of influenza, just like they do with a heart attack, or with any of other reasonable number of illnesses. The truth is, we don't know what the long-term effects are of COVID-19. We're studying them. And if you ask doctors, they'll tell you the truth. They'll tell you that in some cases they're seeing effects on the brain, on the heart, and COVID-19 is unique because it seems to affect different organs throughout your body, not just your lungs. But again, this isn't the case for the majority of cases. We should not report on medical stories this way. A, it causes healthcare related anxiety, which I see day in and day out, especially now. And two, it's not gonna change anyone's minds that disagrees with you. The people who think COVID-19 is a hoax will not be convinced by your over dramatic news reporting. There's no reason to do it. Next, let's look at this tweet by President Trump on August 22nd. The deep state or whoever over at the FDA is making it very difficult for drug companies to get people in order to test the vaccine and therapeutics. Obviously, they are hoping to delay the answer until after November 3rd, must focus on speed and saving lives. If you are a president of a nation, and you have at your disposal the FDA, the CDC, the last thing you should be doing is trying to make them look bad. The more you put out into the public that the FDA has deep state actors or the CDC is not being honest, whatever it is you're tweeting, you're losing the faith of the American people in these institutions. The scientists and doctors that are working day in and day out at the CDC and FDA, they're not hiding treatments and letting people die because they care about who wins the presidential election. What they do care about is making sure everything's done with integrity, with scientific rigor, with accuracy, and that's how it must continue. Because guess what, President Trump? When we do have a good vaccine that's safe, that works, you're gonna need the public's trust in order for them to get this vaccine. And with tweets like that, you're making it very, very difficult. Final point I want to talk about is schools reopening, the fact that there's some infections happening at these schools, universities, local institutions, and I feel like we're approaching these stories with a lot of irrationality, a lot of panic. Remember, my mantra from the beginning of COVID-19 has been stay alert, not anxious. The reason I say this is because there's constantly headlines. University of Alabama has over 1,000 cases in a month. School district in Georgia has 20 cases of COVID-19. We're going to see cases in schools, in our cities, in our states as we begin the reopening process. The danger with COVID-19 is that it can spread like wildfire. And as long as we keep these numbers low, that's what's important. We need to protect the population who is most vulnerable, and we need to make smart decisions with good quality data, not politicize the topic, not try and scare people. And reality is, as we reopen schools, as we reopen shopping areas, gyms, we will see a small spike in COVID-19 cases. It's not about seeing a small uptick and panicking. That's the last thing we want. Students, let's be mature. Let's not throw parties.
Tonight, several UConn students have been evicted from on-campus housing after this packed party.
Let's not say forget COVID-19.
Corona, man. I've been drinking Coronas all day. I personally think it's a hoax.
Look, odds are if you're young and you get COVID-19, it's not going to be the end of the world. But you can potentially spread it to many other people. And when you go to a party, a room full of 100 people, it takes one to get many others sick, who then will travel home and get many others sick. It's about the speed at which it spreads. Focus on school for a short period of time, wear a mask, and at the end of the day, just be reasonable. Something really important to talk about when it comes to covering COVID-19 is that people really look down upon those who are misinformed. And just like I do with vaccine hesitant parents, I do not rush to judge them. That is a surefire way to get them to never see your point of view, to never understand truly how science works. Think about how you can connect with them, to educate them on why it's not stupid and why they should take care. Because right now, as a person without a scientific background, it is confusing. You do hear contradicting opinions on the news, in our politics. So media, President Trump, and everyone in between, let's take a more empathetic approach here and be smart with the things we're putting out to the general public. We all want the same thing: less deaths, a healthier and happier public, and the end of COVID-19. And the only way we can get there is by working together. If you want to check out some of my other interesting content about COVID-19, click here. Or for a more lighthearted playlist that I put together special for you, click here. As always, stay happy and healthy.